I just want to start today by thanking you all for the amazing response you've had for our podcast so far. All of your questions, all of your suggestions, feedback, they encourage us to do better and to look at more topics, to talk to more experts and just give you the best that there is. And today's episode is actually built out of something one of you mailed us about, delayed ejaculation. So I'm Artika and you're watching Allo, Ask the Sexpert, a space where we invite sexual health and wellness experts to talk about sex, pleasure, health and so much more, everything you need to know so that you can have better sex backed by science. Today we have with us Dr. Karthik, who is a psychiatrist with Allo Health. Welcome, Dr. Karthik. How are you doing today?
Thank you. I'm doing fine. Great to be back here again.
Yeah, it's lovely to see you again. So, you're a fertility expert, an andrologist, and a sexual medicine expert. And I think the perfect person to talk about this. So, we all always hear about premature ejaculation a lot. It's becoming more commonly talked about. And it's, part of pop culture and all that. What we have today is something called delayed ejaculation. And I'm sure that's something you've definitely come across in your work with patients and clients, right?
Yes. Premature ejaculation is one of the most common complaints that we come across actually in our clinic. But frankly speaking, out of 100, 80% of them come with PME problems.
Right.
But the most neglected part in sexual wellness, actually, if you ask me, is delayed ejaculation. Okay? Because usually guys are very happy if they are able to last longer. But
there's so much emphasis on trying to last longer.
But they get to realize the problem only when they last longer than what they need.
Right.
Okay, so that is something which we'll have to probably throw some light upon.
Yeah. Just starting from there, and you said it's medically and in sexual medicine one of the most neglected concerns. And so medically or in sexual medicine, how do you define delayed ejaculation? How do you know it's not just lasting longer? It's gone.
The most common question what people actually ask me is, sir, I'm lasting for this long.
Achha.
Is it delayed or is it normal? Now, it actually depends on both the partners.
Okay.
Now, when we come to premature ejaculation, I don't know if you've read this. There is no particular timing. Although World Health Organization states that 2 to 8 minutes is usually okay. But I have had patients who come, my husband performs for 20 minutes. I want it more. Okay. However, I've had patients who come to me and tell, my husband performs for 10 minutes. I'm unable to tolerate after that.
Right.
Now, in this case, the timing actually on the later case is actually lesser when compared to the initial case. But the second case would be diagnosed as delayed ejaculation. So, in simple terms, if I have to tell you, if any of the partners feels that the ejaculation is being delayed, okay, and is not happy with that kind of a time, then it is delayed ejaculation.
Okay. So it's not an absolute measure, so to say, but something that will differ depending on the partner and the compatibility.
Yes.
Is that so?
Yes.
Okay.
It totally depends on the partner.
Okay. And no time per se has been identified for it?
No time per se has been identified. It depends from person to person. One partner might want it longer.
Right.
One partner might like it shorter. So you can't really define.
I think this is a point to talk about delayed ejaculation with respect to pleasure. If you're talking about heterosexual cishet couples, we also have to ask the question that does delayed ejaculation affect chances of pregnancy if there is a couple that's trying to conceive, or affect fertility in any way?
Yes. Now, when we say delayed ejaculation, you will also have to touch upon an ejaculation.
Right.
Okay? Now, delayed ejaculation per se does not affect your fertility, because at the end of it, you're ejaculating sperms into the appropriate place and things are going on scientifically how they are supposed to go. But when we say an ejaculation, where the person is trying so hard, is able to maintain the erection but is unable to ejaculate at all, that definitely affects your fertility.
Right.
Okay, because you're not really throwing out sperms.
Right.
So that does affect.
And that makes it sound like a concern, at least for the people who are trying to conceive. In that scenario, is there some form of treatment, medication, therapy, any form of support available?
Yes.
Now, we know there's IVF, but talking outside of IVF purview.
Yes, IVF is one of the most simplest solutions, but not really. But at the end of it, person needs to experience an orgasm to, catalyze in a relationship. That doesn't really, IVF just helps you conceive, not it doesn't help you in your sexual well-being.
Right.
Now, when I say delayed or an ejaculation, there could be anything. Delayed ejaculation per se, yes, it's comparatively a simple problem because the partner is happy. Since the partner is happy, the male partner also is kind of okay because, okay, I'm able to satisfy my partner.
Yeah.
Now, when you come into an ejaculation, there are different categories. Let's say a person can achieve an orgasm but might not be throwing out sperms.
Right.
A person might not achieve an orgasm and also not throw out sperms.
Okay.
Okay. Now, both are entirely different entities. Okay. There are a lot of hormonal variations there, or there could be a block, in the ejaculatory duct. So many other variations are there. So, if at all you have an ejaculation or delayed ejaculation, it's high time you actually consult a therapist or a sexual wellness expert so that this can be probably rectified. There are treatment options.
Like have it checked out so that you can plan the next sort of path to treatment.
Yes, definitely.
Yeah. I mean, just listening to you say what you said, it's also sounding like you, because we talked about partners being happy, being a way to measure this almost. So it's sounding like it lies at the intersection of sexual wellness and mental health as well, emotional well-being as well. Is that so?
Yes, probably. Like when I say, to be really frank, if I ask which is the biggest sex organ in the body, most of them would point towards their personal organs. Not really. The biggest sex organ is actually the brain.
Right.
Now, when I say delayed ejaculation, now it could be situational. Let's say a person might be able to ejaculate very well with one partner, but might not be able to ejaculate at all with another partner.
Right.
Now, it depends on the excitement that the person has. At the end of it, you need excitement to actually ejaculate. You need that sensation of pleasure. If you're really not liking the partner and if you're doing it forcibly or something, however, your performance reduces that time. But still, if there is no excitement, there is probably no ejaculation, or probably there will be delayed ejaculation.
Right. So it's not an A to B journey to talk about delayed ejaculation. There are multiple aspects to it, and one way out is, of course, that there is support available, which was such an important thing that you shared with us.
Yes, there are medications available. Now, when I say like this, if the person actually is getting bothered by this delayed ejaculation or an ejaculation, it actually means to say we have to rule out if his desire is normal or not.
Right.
Okay, also, let's say it's normal, hypothetically speaking. So then there are various hormonal tests which we can do.
Right.
Now, if everything turns out to, there are various medications which can be given, the basic point is there is help available. It could be in the form of medication, then it could be in the form of, we give something called as vibrators, okay, where, a person is not ejaculating at all, but, just to increase the stimulation, we give him vibrators where he can use it in the personal organ, which help him ejaculate. And there is something more complicated called as electroejaculation, where you actually stimulate the nerves, the nerves which are responsible for ejaculation in simple terms, which again helps the patient ejaculate. So there are various treatment methodologies available. Plus, your therapist, if you consult them, they would also give you certain behavioral techniques which would, in simple terms, what people say is do not try to penetrate unless you feel the urge to ejaculate. Till then, you just stick on to foreplay. Then when you think that you're almost about to ejaculate, then you start with penetrative activity. These are a few simple techniques. Probably a psychologist would be able to throw some more light on it.
No, but that was also interesting. And, even though we've obviously briefly discussed the therapies, it's still interesting to know that there is support available, which means there is an acknowledgement of this happening amongst people. Thank you so much for sharing that with me. I think I came in knowing very little about this, and I've got a lot to read more about at least now. And that is the end of my questions. But I have to take you into our next segment, which is called Ask Your Question. This is a space where we crowdsource questions from our audience members, and they submit their questions anonymously. In case you want to submit a question, there is a link in the description. Right now, I'm going to get into talking to Dr. Karthik about some of these questions. So can I ask you some?
Yeah, sure.
Great. The first question is, I think we've covered it in a big way, but it takes me very long to orgasm. Why? So I think this is saying that there is an orgasm, but it takes very long.
Yes. So that frankly could be, again, there are a lot of variations as I told. Do you even feel the same even when you masturbate? Or do you feel this only when you masturbate or only when you try sex? Now there are various patients who come to me and tell with masturbation everything is normal. Yeah. But when I try sex, I'm not able to ejaculate very soon, or it's taking longer than what I would probably intend it to be, or what my partner intends it to be. Now that means to say specifically if he's doing everything naturally, normally with masturbation, and there is some problem with sexual activity, it means to say there is some problem, either psychologically or with the interpersonal relationship between the partners. So probably you have to look into that. Okay. Or if it is same with masturbation and it is same with the sexual activity also, then high time you consult your expert, get yourself evaluated. Right. But at the end of it, there are treatments varying from very simple meds to, as I told you, ejaculation.
Yeah, and it's completely normal to seek help for this as well.
Totally.
Yeah. Totally. Okay, the next question that I have is, I ejaculate when I have sex, but the fluid is very little. What could it be?
Then again, it's not something where when you say the fluid is little, semen, when we look into it, it is a microscopic structure, frankly, to even tell whether the semen is normal, not normal. Now I have various patients who come and tell my semen is very thin, my semen is very thick, it is very little, it is too much, all these things. To frankly comment on anything about it, you need to get your semen tested first. Now, in the test, if there is any problem, then we will have to look into it. Now, if at all you are ejaculating very delayed or very less, it could be that the sperm is coming out, but it's actually going back into the urinary tract. That could be one of the simplest reasons, which can be solved with very simple 1 tablet a day thing for about maybe 3 months. Right. Okay. Or it could be something as complicated as like your sperm synthesis as such is low, which again makes it more complicated. We'll have to get a lot of tests done, all these things. The point is, do not judge your semen quality or quantity based on what you see. Okay. It is something which I have to put under the microscope, observe, then take a call. Got
it. So it's not even a good way to judge by just observing. Got it. And now the third question, which I was actually saving for the last, which was the reason this whole episode was built actually, which is what is the difference between no ejaculation and delayed ejaculation, and how do you tell the difference?
Okay, let's say in simple terms, as I've already explained in the question itself, if there is no semen coming out of the personal organ, that means that it is an ejaculation, even after appropriate stimulation. For all this to be normal, I am assuming that your erection is good and your relationship with your partner is good. Okay, but if at all you are throwing sperm, whether it is early or late, then it cannot be an ejaculation. An ejaculation means no ejaculation. You are not able to throw out any sperm no matter how much ever you try. Okay. Delayed ejaculation means you are throwing out sperms, but not at the intended time. Maybe it's taking you a bit more longer than what you intended it to be. But there are treatment for both. You need to consult a doctor for that. That is the bottom line.
Yeah. And I think a really good line to wrap up today's episode with. That is the end of today's segment and the episode. Thank you so much for being here and answering all of those doubts and questions that I had, and I'm guessing a lot of other people had as well. Today's episode was wonderful, and just also telling you all that we take all of your emails and feedback very seriously. It encourages us to do better and do more each time. So I'll see you again with another episode. Until then, this is Dr. Karthik and Artika signing off. Take care and bye.